Today, we're diving into a topic that might not be on everyone's radar, especially if you live in a tropical climate like the Philippines. But it's incredibly important for global travelers and outdoor enthusiasts. We're talking about tick-borne diseases. Now, before you start feeling itchy, let's get into the facts. So, what exactly are we dealing with? Ticks are tiny arachnids, related to spiders, and some of them can carry and transmit diseases to humans and animals when they bite. While there are many tick-borne illnesses, today we're focusing on two of the most well-known: Lyme disease and Rocky Mountain spotted fever. Let's start with Lyme disease. This is probably the one you've heard of most. It's caused by a type of bacteria called Borrelia burgdorferi, which is transmitted by the bite of an infected black-legged tick, often called a deer tick. The classic telltale sign of Lyme disease is a rash that looks like a bull's eye. It's officially called erythema migrans. It usually appears a few days to a month after the bite, starting as a red spot that slowly expands, often with a clearing in the center. But here's the tricky part. Not everyone gets this rash. Other early symptoms can feel a lot like the flu. You might experience fever, chills, headache, fatigue, and muscle and joint aches. If it's not caught and treated early with antibiotics, Lyme disease can progress and cause more serious problems. These can include severe joint pain and swelling, particularly in the knees, and even neurological issues like facial palsy, where one side of your face droops, or meningitis, which is an inflammation of the brain and spinal cord. In some long-term cases, people report issues with memory and concentration. Now, let's talk about Rocky Mountain spotted fever, or RMSF. Despite its name, this disease isn't just found in the Rocky Mountains. It's seen in various parts of North, Central, and South America. It's caused by a different bacterium, rickettsial, and is transmitted by several species of ticks, including the American dog tick and the Rocky Mountain wood tick. RMSF is often more severe and can progress much more rapidly than Lyme disease. The early symptoms are also very nonspecific, which can make it hard to diagnose. They usually start about 2 to 14 days after a tick bite and include high fever, severe headache, nausea, vomiting, and muscle pain. A few days after the fever starts, most people will develop a characteristic rash. Unlike the Lyme bull's eye, the RMSF rash typically starts as small, flat, pink spots on the wrists, forearms, and ankles, and then spreads to the trunk, and sometimes even the palms of your hands and the soles of your feet. The key with RMSF is rapid treatment. It's a serious illness, and delays in getting antibiotics can lead to severe complications affecting organs like the kidneys and heart. And in some cases, it can be fatal. So if you've been in a tick-prone area and develop a fever and rash, it's crucial to see a doctor immediately. So, how can you protect yourself? Prevention is everything. If you're hiking or camping in areas known for ticks, like wooded or grassy regions, especially in North America, wear long sleeves and pants. Tucking your pants into your socks is a classic, but effective, move. Light-colored clothing can make it easier to spot ticks. Using an insect repellent that contains DEET on your skin and treating your clothing with permethrin can also be very effective. After you come inside, it's a good idea to do a thorough tick check on yourself, your kids, and your pets. Pay close attention to areas like your armpits, groin, behind your knees, in your hair, and around your ears. If you find a tick, don't panic. The best way to remove it is with a pair of fine-tipped tweezers. Grasp the tick as close to the skin's surface as possible and pull upward with steady, even pressure. Try not to twist or jerk the tick, as this can cause the mouth parts to break off and remain in the skin. After removing the tick, clean the bite area and your hands with rubbing alcohol or soap and water. While these diseases are less common in places like the Philippines, knowledge is power, especially if you're planning to travel. Understanding the risks and knowing the signs can make all the difference. Always be aware of the local health risks wherever you go. Thanks for tuning in today. I hope this was informative and helps you stay safe on your adventures. If you found this video helpful, give it a thumbs up and don't forget to subscribe for more content. Stay safe out there, and I'll see you in the next one.